Well, let me welcome you back. Xingxi, would you shut the door back there? Maybe give them one last chance to get in for last call. Thanks. This is a panel discussion that is going to look at mental health and the meaning of violence. And we have three panelists, only two of whom you can see. Our third panelist and a discussant is Mike Luo, who writes for the New York Times. So some of those headlines that you saw Tom Insel show on a slide this morning were the headlines to stories that Mike and his colleagues have written. You're free to picture him, Eric, tall, dark, and handsome, sitting here. But we can't see Mike, but we will hear him, and he will hear us. I don't know if he's on the line now.
Yeah, I'm here now.
Hi, Mike.
Hi, everybody.
Welcome. You have about 35 members of the forum around a table, a lot more interested experts and guests and participants and speakers around the outside. And let me introduce you and the other two panelists here. I'll start with Mike. And Mike is a reporter for the New York Times who wrote some extraordinary stories over the past couple of years about guns, and particularly about guns and mental illness and guns and children. And they involved remarkable research. And I think Mike would have been here, but he is a new parent who is just coming off of paternity leave for his second child. Also now is assuming a new job as deputy metropolitan editor for the New York Times. So for all those reasons, Mike couldn't take his time away to be here with us physically, but he is enthusiastic, and we're delighted to have him on our panel. In addition to being the deputy metropolitan editor for the Times, Mike has written some very long, deeply investigated and research-based stories for the Times. And I think we'll have copies of these and the links for you to see. But they were really impressive investigations on these topics. So we're delighted to have you kind of here with us, Mike. And thanks for joining us. We also have on our panel Daniel Webster. And Daniel is a professor of health policy at Johns Hopkins Bloomberg School of Public Health. He's the director of the Hopkins Center for Gun Policy and Research and deputy director for research for the Hopkins Center for the Prevention of Youth Violence. And he's faculty at the Hopkins Center for Injury Research and Policy. He's also the co-editor of a book that was based on a meeting at Johns Hopkins shortly after the Newtown shooting called Reducing Gun Violence in America, Informing Policy with Evidence and Analysis. And I think that title speaks so much. It speaks to so much of what is missing from the debate and the heat that's shed on this topic. And we hope to shed light and hope to make it evidence-based light on the topic of means. And Daniel has published many articles on firearm policy, on youth gun acquisition and carrying, and the prevention of gun violence. And I would also say what's not in the written biography, that Daniel has been brave in choosing this field and doing this research. And he is very committed to this. And I would say, make no mistakes, this is a fight. It's a fight using science to save lives, but it's a difficult one. And Daniel has been a brave and persistent pioneer in this field, so we're delighted to have you here, Daniel. Our third panelist is Michael Phillips, who is a member of this forum, and the director of the Suicide Research and Prevention Center of the Shanghai Mental Health Center, executive director of the WHO Collaborating Center for Research and Training in Suicide Prevention at Beijing Guilongguan Hospital, and professor of psychiatry and global health at Emory University, and professor of clinical psychiatry and clinical epidemiology at Columbia University. He is currently the principal investigator on a number of multi-center collaborative projects on suicide, depression, and schizophrenia. And Michael has done an extraordinary job in looking at the problem of suicide and suicide attempts in China. And he has been persistent and dedicated in what he has done there. He has gone from some initial studies, I don't know if it was maybe 25 years ago, Michael, how long have you been? 20 years ago. And a sustained effort in bringing some of these studies to scale, a spectacular scale, that has shed so much light and compiled so much data and evidence on this problem. Michael has also been a persistent advocate for this forum and makes sure that anyone, whenever they say the word violence, follows that by saying, including suicide. So he has made sure that we don't fail to address this, and he's also part of a current effort at the World Health Organization to put out a new report on suicide, and has been a key part of that effort, bugging them just as much as he has bugged us with very good results. Let me introduce this topic and get here by just a couple of personal points. Last fall, I was able to give a talk here at the annual meeting of the Institute of Medicine. And I focused my talk on making 3 points. The first point is that we can prevent violence, that the prevention of violence must be based on science. And science is every bit as important here in violence prevention as it is in the development of new pharmaceuticals or new medicines and new medical devices. And it will be just as effective as science was in the prevention of heart disease and cancer and motor vehicle injuries. So we have every reason to be optimistic about the ability of science to deliver answers to these problems of violence, and in particular, to the questions that arise at the intersection of mental illness and violence. But the second point I made there was that keeping science in the forefront will not be a slam dunk. This will not be easy because there are challenges, including political forces and strongly held social and cultural beliefs that may stand in our way. And I think it is so important that we keep politics from interfering with the science. And it is not just the politics of Wayne LaPierre and the NRA, but it is sometimes the politics of researchers coming from the other side and their interests that they have at heart. But we have got to support our scientists so that they can collect data and do work that is scientifically valid if we want to find the answer. This is a tough fight. So when I talk about Daniel being brave, or about Michael pushing new frontiers and new boundaries, these are tough but very, very important jobs. And the third point that I made in the fall was that the field of violence prevention must be collaborative. We have got to work together with people from a wide range of disciplines, but also people who share a wide range of beliefs. And in this area of guns and violence, that means that we have to acknowledge that in this country, there's a constitutional right to own weapons. And in this country, there is a strong, strong group of people to whom guns and hunting and shooting at targets are important. They're an important part of their life. So it means to be collaborative, we have to acknowledge two things: that we're trying to reduce firearm injuries and deaths, but also that we're trying to preserve the rights of legitimate gun owners. We have to do both things, and we have to do both things at the same time. You may say, oh, it's kind of hard for us to recognize the rights of legitimate gun owners because I don't have a gun, I've never shot them, and I think they're the root of all evil. And the best way to prevent fatal injuries associated with violence is just to get rid of all guns. Some people may say that on one side, and the other side will say what Wayne LaPierre says, is that this is a God-given constitutional right, and you're not going to take these guns away from us. These positions both have to be recognized as reflecting important goals: reducing firearm injuries and death and protecting the rights. And collaboration means you acknowledge both objectives and do the science that will help you reach both objectives. It's not impossible, and I think it's the most important way forward. I had made these points to some people who work on a major network, and they were doing a documentary on children and guns. It was a special. It was a 1-hour special involving their star newscaster. And they said they wanted to interview me and a very good friend. My friend happened to be the person who was a spokesperson in Congress for the NRA in 1996. He was the one who attacked us at CDC and the one who introduced the legislation that ended in removing all of the money we had appropriated to develop the science base on firearm injuries. The NRA wanted that stopped. Congressman Jay Dickey led the effort to remove the funding. He removed the funding and effectively stopped the research at CDC. But we stayed in touch, and it turned out that this person who was for a while my archenemy has now become a good friend. And both of us wrote an op-ed piece for the New York Times that said that we should learn lessons from reducing motor vehicle injuries and deaths, that the science and research are really critical in making safer cars, safer roads, and safer drivers without banning cars. And we could do the same thing with firearms. We both wrote it, we both signed it, and this news show said they wanted to feature both of us because they thought the science was really important. So I flew to Arkansas, to the heart of duck country, and sat in the middle of 27,000 ducks, all honking and quacking at the same time. And they interviewed us, and we talked about how science was important, how we could come to agreement, this was the way forward. And we waited for the special to air. And when the special aired, we watched for our part, but we had been edited out. And it turned out that what the producer wanted was tabloid entertainment, and to show kids finding guns and, despite the warnings of parents, aiming them at each other and pulling the trigger. They showed shooting parties where parents held birthday parties for kids, not where you go to jumping jacks, but where you do shooting, and where 3- and 4-year-olds got a chance to shoot machine guns at targets. And you heard parents saying, this is the way to gun safety. Things that were totally untested. And even the idea that science might yield an answer and that evidence and data had a bearing on this problem, they edited all that out. My friend Jay Dickey called it data rape. They stripped it of any mention of evidence or science, and it was infotainment. It was really, really bad. But that's what people want, and that's what people are fed, and that's what people are shown. So when we talk about the importance of this fight, and this fight to use evidence and science to save lives, it is not easy. It really isn't, but it is so important. So we are really lucky and very glad to have Mike Luo, Daniel, and Michael on this panel, because what we're going to try and show really is what evidence and data can show and how they can show the way forward. I'm going to start with Daniel and ask him to answer some of these questions. And then we'll go to Michael, then Mike, and then you.